there, crapsters. It's Rosemary, aka Liar Liar, Hands on Fire. I thought I would hop on today and talk about kind of a random subject that doesn't affect most of us, but I wanted to talk about plastic surgery or elective surgery, surgeries that you opt into for reasons that aren't for the benefit of your health, but for changing the way you look, changing the way things appear. Now, personally, I have zero issue with anybody wanting to get elective surgery or plastic surgery, anything that makes you feel more beautiful, more comfortable in your skin, more authentically you, any of that. I am totally fine with anybody wanting to do that and make yourself feel better overall. The only thing I want to hop on today and talk about is the risk of surgery and CRPS possibly intermingling, because that is a possibility. There are risks to any surgeries, regular, plastic, elective, or otherwise. Some the doctors will go over with you before you undergo the treatment. Some they don't, because there are so many possibilities, most of which are very, very small in percentage or likelihood. But there's still risks. They can still possibly happen. They have happened, hence to somebody, hence the risks. That's why they make you sign all those papers before you undergo them, because they want to make sure that you understand in general the risks that could come with these surgeries. But one possible risk that I'm almost positive that most doctors would not go over with you about would be the possibility of getting CRPS, because the likelihood is so small. It is very likely that you will not have this issue if you have any plastic surgery, because it is a very rare disorder. It doesn't happen very often. It's a 1 in a million sort of thing. I have a friend who I met on Facebook in a group for CRPS sufferers, so they can hop on and share their story and support one another. And this young woman just happened to cut her hand. She works on a farm doing her work, and it wasn't a very serious cut. I don't think she even had to get stitches, but it was serious enough that, or significant enough rather, that the body responded, and she now has CRPS in that hand, unfortunately. My event that triggered CRPS in my body was far more serious and far more unlikely to happen to anybody. It was a spontaneous bleed in my spinal cord, which is a little more serious than a cut in the hand, but both of them triggered the same thing. CRPS can come from any injury to the body or surgery to the body. No one really knows what specifically triggers your nerves to kind of fire up almost literally and react inappropriately to a injury to the body. So that means we can't necessarily predict what will cause CRPS, what injuries will cause CRPS, and what injuries won't cause CRPS. So any surgery that you undergo, including ones that you need for your health reasons, can run the risk of triggering CRPS in your body. So while I'm totally fine with anybody wanting to get any sort of elective surgeries, I want to caution everybody and make sure that they know that this is a possibility, that they could wake up and be on fire, and that's just their life from now on. And I don't want that to happen to anybody. Not 1 in a million, not 1 in a billion, not 1 in quadrillion, million, zillion, because I wouldn't wish this on anybody at all. So that's the only reason I came on today to talk about plastic surgery at all, because the only issue I have with plastic surgery is that this could be a possibility for you waking up and having CRPS. And I don't think changing your body is worth the kind of pain that I suffer and CRPS patients suffer. I'm sure most of them would agree. They wouldn't change any part of their body if it meant that they had to then deal with this kind of pain. So that doesn't mean I'm saying don't get plastic surgery. I'm just saying go in with your eyes wide open and understand that that is a possibility, a very, very, very small possibility. It's more than likely, far more than likely, that it won't happen to you. So in that sense, this video is kind of pointless, but I just wanted to remind people that there is that possibility, and to kind of think twice before deciding to have plastic surgery, which I know most people with their doctors go through all the motions that they have to. No one's just going and waking up and saying, I think I'm going to get plastic surgery today. Like, that doesn't really happen. So this, I just think, should be one of the things that you do consider as you think about going through a surgery that you don't necessarily need to improve your health. So that's it. I hope this was helpful. I hope that this is something that you can take into consideration if you decide to go through any medical procedure that is invasive or could cause injury to the body. I hope that it doesn't affect anybody else in the world. I know it will, but I hope that this was helpful information, and I hope that you have a wonderful day today, and I will see you guys next time. Bye.